Welcome back to our deep dive into the future of medicine. Today, we are exploring mental health innovations and how artificial intelligence, AI, is reshaping psychiatry. This topic is not only relevant for doctors and medical students, but also for everyday individuals who are becoming increasingly aware of the importance of mental well-being. For decades, psychiatry has been one of the most complex branches of medicine. Unlike cardiology, where a test can show you blood pressure or heart rhythm, mental health conditions are often invisible, subjective, and influenced by multiple factors, from genetics to environment. But in recent years, cutting-edge technology and AI-powered innovations have opened new doors, helping us diagnose, predict, and treat mental health disorders with greater precision than ever before. The current global mental health crisis. Let's begin with context. According to the World Health Organization, WHO, 1 in every 8 people globally lives with some form of mental disorder. Depression and anxiety alone cost the world economy nearly $1 trillion every year in lost productivity. In low-income countries, nearly 75% of people with mental health conditions receive no treatment at all due to stigma, lack of resources, and shortage of trained professionals. This global crisis is why psychiatry is now becoming a focus for innovation. The question is, how can AI and new technology step in to bridge the gap where human resources are insufficient? AI-powered diagnostics. Traditionally, diagnosis in psychiatry relies heavily on patient interviews, self-report questionnaires, and behavioral observations. But AI has added a new dimension. Researchers are now using machine learning models to analyze speech patterns, facial expressions, and even social media activity to detect early signs of mental health issues. For example, subtle changes in tone of voice, word choice, or pause length during speech can be indicators of depression or schizophrenia. In fact, AI systems have shown up to 85% accuracy in detecting depressive symptoms based on voice alone. Similarly, smartphone sensors can monitor sleep, activity levels, and screen time patterns, creating a digital footprint of behavior. These continuous data points give psychiatrists a clearer picture than a single 30-minute consultation could ever provide. Digital therapeutics and VR therapy. Now let's talk treatment. One of the most exciting innovations is digital therapeutics. These are smartphone or computer-based programs approved by regulatory authorities like the FDA that can treat mental health disorders. For example, Resetto is a digital therapeutic for opioid addiction, while Somrist helps treat chronic insomnia through cognitive behavioral therapy delivered via app. Virtual reality, VR, is also making breakthroughs. Imagine someone with post-traumatic stress disorder, PTSD. Traditional therapy involves talking through trauma, but VR allows controlled exposure therapy, safely immersing the patient in a virtual environment that simulates triggers, helping them process trauma in a step-by-step, safe setting. Studies show VR therapy can reduce phobias, anxiety, and PTSD symptoms significantly faster than traditional talk therapy alone. AI and drug discovery for psychiatry developing psychiatric medications has always been challenging, because mental health disorders involve complex interactions between neurotransmitters and brain circuits. Traditional drug discovery can take 10 to 15 years. AI is accelerating this timeline dramatically. By simulating how new molecules interact with brain receptors, AI systems are identifying new drug candidates in months, not decades. Already, companies are using AI to explore treatments for conditions like treatment-resistant depression and schizophrenia. This not only reduces cost, but also increases the chances of developing medicines with fewer side effects. A big improvement, considering how many patients discontinue psychiatric drugs due to unwanted side effects. Wearables for continuous monitoring. Wearables are another revolution in psychiatry. Devices like smartwatches can track heart rate variability, sleep cycles, and stress responses. But advanced devices go even further. Some can measure galvanic skin response, essentially how your skin reacts to stress, providing real-time data on anxiety levels. Imagine a future where your psychiatrist doesn't just ask, "How have you been feeling?" but instead has a full week of biometric data showing when your anxiety spikes, how often you wake up at night, or whether your meditation practice is lowering stress markers. This data-driven approach personalizes treatment like never before. The role of chatbots and AI counselors. Here's something that sparks debate. AI chatbots for therapy. Tools like Wobot and Wysa use AI to deliver cognitive behavioral therapy, CBT techniques through text-based conversation. For someone hesitant to see a therapist, these chatbots can act as a first step, available 24/7, affordable, and stigma-free. While they can't replace human empathy, studies have shown significant improvements in mood and reduction of anxiety for users. Some critics argue that relying too much on AI could dehumanize psychiatry, but others point out that these tools are life-saving for people in areas without mental health professionals. Ethics and concerns. With innovation comes responsibility. AI in psychiatry raises serious ethical concerns. Who owns the sensitive data collected from patients' speech, smartphone activity, or brain scans? How do we ensure AI doesn't misinterpret cultural differences in communication as mental illness? There's also the risk of bias. If AI models are trained on data from one demographic, they may not accurately diagnose people from other cultural or ethnic backgrounds. Regulators are now working to create frameworks that balance innovation with patient safety. The future of psychiatry. Looking ahead, the future of psychiatry is a blend of human expertise and AI assistance. Imagine AI systems screening millions of people worldwide through smartphones, identifying those at high risk, and connecting them with human psychiatrists for personalized treatment. Brain-computer interfaces, BCIs, may even allow psychiatrists to monitor brain activity in real time, opening possibilities for direct neurofeedback therapies. Combined with gene editing tools like CRISPR, we may one day be able to prevent certain psychiatric conditions before they fully develop. Another fascinating application of AI and robotics in healthcare lies in rehabilitation and elderly care. Exoskeletons powered by AI can help stroke patients regain movement, guiding them through repetitive exercises with precision and patience far beyond what a human therapist could manage. For elderly patients, companion robots provide not just assistance with daily activities like reminding them to take medication or monitoring vital signs, but also offer emotional support, engaging in conversations and reducing feelings of loneliness. Studies in Japan and Europe have shown measurable improvements in mood and health outcomes among seniors who regularly interact with such robotic companions. Let's not forget about AI in mental health treatment. Platforms using natural language processing can detect subtle signs of depression or anxiety in a patient's speech. For instance, if a patient consistently uses negative self-referential words or shows patterns of withdrawal, AI can flag this to clinicians much earlier than traditional methods might allow. Mental health apps powered by AI now guide millions of users worldwide through cognitive behavioral therapy exercises, stress reduction activities, and even mindfulness routines. In the diagnostic space, robotics and AI converge to create hybrid solutions. Imagine a robotic biopsy arm that, guided by AI-driven imaging, can pinpoint the exact spot of abnormal tissue in real time, reducing errors, lowering risks, and improving recovery times. This type of precision means fewer unnecessary procedures and faster treatment plans. There's also the field of AI-driven drug development. Traditionally, developing a new drug could take over a decade and cost billions of dollars. Today, AI algorithms sift through immense biological databases to identify promising drug candidates within months. During the COVID-19 pandemic, AI accelerated vaccine research by analyzing protein structures and predicting how the virus would evolve. In cancer research, AI has identified new compounds that show early promise in clinical trials, potentially shortening the path to life-saving treatments. Another key breakthrough is AI-powered robotic surgery training. Advanced simulators equipped with AI provide surgeons with immersive practice environments, giving real-time feedback on technique, pressure, and precision. This not only speeds up training, but ensures that surgeons can practice complex, high-stakes procedures safely before entering the operating room. Despite the extraordinary potential, challenges remain. Issues of trust and accountability are front and center. Who is responsible if an AI-driven robotic system makes a mistake? Regulators and healthcare institutions must grapple with legal and ethical frameworks to ensure patients remain safe while technology advances. Data privacy is another pressing issue. AI systems need vast amounts of patient information, raising concerns about security breaches and misuse. However, the benefits are undeniable. Hospitals that have adopted AI-assisted robotic surgeries report lower complication rates, reduced blood loss, and shorter patient recovery times. Patients who might once have spent weeks in hospital can now return home in just a few days. AI and robotics are not replacing doctors, but they are reshaping medicine in ways we once thought impossible. Stay tuned as we continue this series on medical innovations shaping the future of healthcare.